Hello friends, so we are back with the new topic and our today's topic of discussion is mouth breathing. According to Sassoni, mouth breathing is a habitual respiration through mouth instead of nose. Finn in 1987 classified the mouth breathing into three categories. First anatomical, second obstructive and third habitual. Anatomic mouth breathing is because of the short length of upper lip. Obstructive mouth breathing is because of the obstruction in the nasal passage like nasal blockage or deviated nasal septum. And habitual mouth breathing is because of the associated habits. Now coming to the etiology, mouth breathing can be because of many reasons like deviated nasal septum, because of the constant or the frequent rhinitis known as allergic rhinitis, because of the enlarged adenoids or tonsil, because of the short upper lip, and because of the obstruction of the larynx. Sometimes it is because of obstructive sleep apnea, and then genetic may also be its reason. Now coming to the clinical feature, the general typical feature of mouth breathing patient is large facial height. They will have a typical adenoid faces, large faces with high arch palate and narrow nostril, dull mask-like face, sunken eyes, protruded upper lips. Then increase in mandibular plane angle, retrusion of the mandible, then V-shaped arch because of the buccal collapse of the maxillary interior, and nasal passage. Coming to the diagnosis, first we will take the history of the patient, that why the mouth breathing occurs, what may be the reason like allergic rhinitis, otitis, ear pain or any other. Second, we will do the different type of clinical test. Like first will be mirror test, where a double side of mirror is taken and put it below the nose to check whether there is nasal breathing or mouth breathing. If there is fogging on the upper side below the nostril, then it is because of the nasal breathing, and if it doesn't, then it is a case of mouth breathing. Coming to the butterfly test, a piece of cotton wisp is taken and put it around the nose, and if it moves during breathing, then it is because of the nasal breathing, otherwise it is mouth breathing. Then water holding test, patient is asked to hold the water inside the oral cavity, and if it is for him, if it is easy, then it is a case of nasal breathing, otherwise it is mouth breathing. Coming to the treatment part, before starting the treatment, we will see whether it is because of the habitual or the obstructive reason, or whether the mouth breathing is total or the partial. First, we will eliminate the cause by checking it or by the surgical intervention, and second is accept the habit by putting it the oral screen,